Hi, it's Henry Shelford, Chairperson of SarcoidosisUK, with Jack Richardson, Senior Executive of SarcoidosisUK. So we promised an update today on a programme we're involved with, which is the Royal College of GPs Spotlight Programme. What we're trying to do, I think we've said that 2020 is the year of a live video for us and trying to get better at video, but also using it to engage with to tell you more about the process of things. So otherwise, you only find out about things, when they're in the newsletter or when they're done, and not sort of all the work that's gone in along the way. And I think it's really helpful for us to tell you about those things. So this is something we've been working on for a number of months now, and we think it's very important, and so we want to tell you about it. So first sensible question is, what is it? Okay, so Jack, what is the Spotlight Programme?
So the Spotlight Programme is run by the Royal College of GPs, as you say. They run it each year, and they have multiple Spotlight programmes running at once, and the point is to raise the profile of a specific clinical area. So that could be lots of different things, because obviously GPs work with almost all different conditions, and so in our case, sarcoidosis, we're hoping to raise the profile of sarcoidosis.
And so this feeds into, with all rare conditions, they're individually rare. We're 1.5 in every 10,000, but they're collectively common. So there's 17 million people in the UK who have a rare disease. But a GP, so they're around 6,000. So a GP, there's no way they're going to be able to stay on top of 6,000 diseases and know what's happened, what is the latest information on it. If they've got one patient with, they may have one or two patients with the disease at all, if at all. And so we've got to recognise that they're not going to stay on top of it, and instead, although try to get them on top of it, but instead we need to make sure that they have the up-to-date information from somewhere reliable, and that's the Spotlight Programme, which is detailed information for the GP on the Royal College of GP's website, so that when they see sarcoidosis, they know where to go to. Now they can come to our website right now, but the Royal College of GPs, they know it's in a format they understand. They're able to very quickly go through it, and it has the credibility. So for them, when they hit a rare disease, instead of going, where do I go? They can go, I go to the Royal College of GPs website. That's my process. All 6,000, that's my process, and that's being built up over time.
Yeah, that's right. So we've spoken to patients, obviously, lots of patients we speak to, spoken to GPs, spoken to consultants as well. And
you spoke to some other charities, in particular there's one you spoke to.
Spoke to other charities, spoke to another charity for Ehlers-Danlos syndrome, which is another rare disease with similar prevalence to sarcoidosis.
And actually we had the good luck when we were at the Rare Disease UK event in Parliament. We actually met some of the trustees there who again reiterated what I think you were about to say.
So they, Ehlers-Danlos syndrome charity, they ran a Spotlight project a couple of years ago with the Royal College of GPs, and found that it was an incredibly useful thing for them to do in terms of raising that profile of a rare condition.
I think they literally said it's one of the best things they've done. They were so pleased with the impact it's had, and we know, I know, the misdiagnosis, the difficulty of getting diagnosis from your GP, the often misdiagnosis, then the risks of it not being taken seriously. So I think if we cover some of the basics, so what is the Royal College of GPs? Why are they such a good partner? Do you want to quickly cover that?
So I think so the Royal College GPs is the membership, professional membership body for GPs. So there's 52,000 GPs which are members, and they really cover the whole journey from training them in the first place, all the way until very experienced GPs who've been GPs all their lives will go to the Royal College for their.
And to be a GP, you've got to be a member.
Yeah. So
it sits underneath the Royal College of Medicine. How does it work?
I'm not quite sure on their relationship, but they're certainly they're the go-to body for the best practice, for the best information, for the newest information. And so when I've spoken to GPs in kind of writing up this project, and they've said that's their one-stop shop, that's where they go, and at the moment there isn't any information on sarcoidosis, so they have to look elsewhere, which is the problem really. There's really like a lack of good information to help GPs manage sarcoidosis
Well,
patients.
we provide good information, but like the GPs don't have to go there, and they've got their 15 minutes, haven't they? So we're just talking about what's the problem we're trying to solve. And I think that's it, that GPs have this limited amount of time, and they need to know where to go for reliable information, and if this is their one patient with sarcoidosis that the first they've seen for years, like Royal College is somewhere they know to go to.
Yeah, so it's about, I mean, it's two main things. It's raising the awareness for GPs, so GPs can recognise the early indications of sarcoidosis, and then once they've done that, it's about knowing when to refer, which patients to refer, and who to refer to. So at the moment, that's a really complicated situation for GPs because sarcoidosis is so complicated, and so we want to give them that information about helping them make sure they're making the right referrals at the right time.
And we get calls and messages all the time with people telling us about how challenging it was to get their GP to refer them to get that diagnosis. You know, for myself, I think I went to my GP countless times. I think, God, I can't quite remember exactly how many sets of antibiotics I was sent on. In the end, it took me to say, like, this is the last lot of antibiotics you're giving me. I think if this doesn't work, you're referring me. It can't be up to us to have to be this. Have to be strong when we're weak. Like, we need to get that information for GP so they know what to do. You've had some help with writing the application. Who's helped?
Yes, I mean, I wrote this application, which we sent off last week, which was very excited to kind of send to the Royal College, but I'm not a...
So this is the entire thing.
That's it. I'm not a patient myself, so I talked to a number of patients to hear their perspective. I talked to a number.
But you've worked here how long?
5 years.
Yeah, so you got some knowledge.
Got some good contacts. Spoke to GPs because that's obviously so important to know from their perspective what would be useful for them to help improve that management of sarcoidosis. Also spoke to members of our clinical board who are consultants, who are also part of that that healthcare journey as well, and family members of patients with sarcoidosis as well. So lots of people fed into this application to make it as strong as possible.
And also people like Joe Wright, who's one of the nurses on the helpline. So many people would have spoken to her. She's also a patient council member and support group lead. So she does a lot of incredible work and helps a lot of people. And she put in a quote: we need to educate medical practitioners that sarcoidosis can be life-limiting, and we all know that many practitioners don't realise that it's a complex, multifactorial disease. We need practitioners to understand that this is a systemic disease that affects the entire body. It's not just the lungs, and if it's only active in, and even if it's only active in a single organ, it may have far-reaching biological, psychological, and social implications. And those wider implications. We have a survey, and thank you everyone who answered it. So we had 1,500 answers last year, and just shy of half reported their symptoms as first being diagnosed as another condition. And so that's that problem that GPs don't know, so they diagnose it as something else. A quarter said it took more than 10 weeks between that GP appointment and getting to see a consultant. It's obviously supposed to be 6 weeks. Over 1 in 10 said they had 10 or more appointments with their GP before they got to see a specialist. I think for me it was 5 or 6. I actually now remember it's 4 sets of antibiotics.
So importantly on that is it's 10 or more with those sarcoidosis symptoms, so not presenting with other things, but 10 or more appointments with those same sarcoidosis symptoms, and then a referral. And
we know that the damage is cumulative. You can't repair the scarring in your lungs, and so that time wasted is critical. And 1 in 5 said the communication with their GP and their consultants was poor, very poor. And we talked to a family, and that breakdown in communication directly contributed to the loss of someone, and we need to make sure that doesn't happen again. So it is very important. So where we have consultants passing down back to GPs and GPs not knowing what to do, we have to fix that, and we need to make sure that communication is good. So what happens now?
So we've sent off the application to the Royal College. They're reviewing it at the moment. They come back quite soon, so I think it'll be next month. We'll find out if we're successful.
And they'll only do a few. They only do a limited number.
Yeah, so it is a competitive thing. They work with lots of charities and other external organisations, and as you say, sarcoidosis is one of 6,000 rare diseases. So that there might be competition with others, but I think it's a strong application. I hope we'll be successful, and if we are, then we'll work together with the Royal College of GPs. We'll have a clinical champion, which is a GP working in the field with a special knowledge of sarcoidosis who will work with us, and then it'll be a year-long project that we'll do.
And it's it remains our challenge, right? We're a rare disease. It's us who care, and constantly trying to push to get others to recognise the need, and it's a big part of our work. And with the Royal College of GPs, a big part of what we've got to do is say, like, look, this is important, and doing this will make a difference. So we've put our pitch forward, and we'll see. And then you said it'll take if we get it. And just to be clear, also they charge for this. This isn't a part of their free service. We have to put in our contribution is going to be between £15,000 and £20,000. Now, we think it's absolutely essential to get GPs providing good service for people with sarcoidosis, and this is the best way to do that. And so we think it's worth it. But gosh, it's a lot of money, and we want to do it. But it just gives you an idea of some of the work we have to do, both in fundraising and in persuasion, to get this kind of action, to happen. We're also going to be working to try and lobby for the NHS to fund this, because we think this should be done for every rare disease, and there should be a pack for all GPs to be able to look it up, and so we're lobbying on that as well. But we need to do this now because we know of lives being lost because of failures in this system. So it's very, very, very important. Mm-hmm. And so the last thing is, so we're going to find out in a few weeks. Mm-hmm. If we've got through to the next stage, and it gets published, it would get published in about a year. Is that right?
Yeah. So it's a year-long project. So we'll be looking at sort of next spring. But then it really would be an investment in the future, because that will then exist online, as that toolkit for GPs would exist, and that can be used for a long time, because we can go back and update it if new information becomes available.
Yeah, and if you think about our goals in SarcoidosisUK, so it's providing quality information, providing support, building awareness, and funding research. And you can see this very clearly fits into supporting GPs and supporting people to get good care, providing good information. It's available. Everyone can see it, but really providing good information for the GPs, and it will also build awareness amongst GPs. So it's really going into three of those main goals. I think that's it.
Yeah, I'm excited.
Yeah. Thank you very much, everyone, for watching. We haven't been able to see questions, so we'll respond to any that we can that are relevant. If people are asking anything about COVID-19, we are going to be doing another video with Dr. Rabina Coker. That's going to be done on Friday at 11:30, and so we're going to see her at Hammersmith Hospital to provide an update based on the latest information. Obviously, things have moved on since the last video, and that's something we arranged in case it got worse. So that is set up, and we look forward to doing that. We're obviously worried about it. So thank you everyone for watching this. Thank you, Jared, for spending a lot of time and work putting in that application. Fingers crossed for it.
Yeah.
But if we don't get that, we're always working on other things. But thank you. So good work. Well done.
Thanks.
And thank you everyone for watching.
Thanks.
Thank you. Bye bye. Bye bye.